and good afternoon, everyone. Just to do a quick speaker check to make sure you can hear us. We're slowly letting everybody into the room, but thank you so much for joining us. We'll get started here in just a minute. We're letting a couple more people in, but just wanted to make sure you could hear us. Thanks for joining us for the Quarterly Quality Improvement webinar this afternoon. And I believe everybody is in, so we'll go ahead and get started. Thank you all for joining us this afternoon for our Fall Festival for the Quarterly Quality Improvement webinar. For today's webinar, we'll be talking about influenza, antibiotic stewardship, and since those are both submitted through the NHSN website, we'll also be going over that today. So thank you for joining us for today's webinar. These quarterly quality improvement webinars are brought to y'all by our friends over at Texas A&M Rural and Community Health Institute, Tammy and her team, as well as our friends over at the Texas Hospital Association, Sheila and her team. So between the three of us and the regional coordinators here at the State Office of Rural Health, our job is to support you and make your job easier when it comes to everything you do for quality improvement. So today's webinar and a lot of the quality improvement technical assistance that's provided to you is supported by the Health Resources and Services Administration, HRSA, through the FLEX program here in the state. So moving on to the next slide, what we'll be talking about today for some of the learning objectives is Tammy's going to explain to us and examine and analyze and show some of the usage for the MBQuip portal website and also the Emergency Department Transfer Communication Database, looking at the views and when it's viewed and looking at some of that usage data. And then she'll provide us an overview of where we are as a state when it comes to NHSN influenza data, how the cause measure up and how we measure up as a state when it comes to submitting some of that influenza data. And then we'll turn it over to Sheila, who will discuss and share some of the tips for the NHSN website, as well as some of the antibiotic stewardship, since that's also submitted through the NHSN website. And then we'll wrap up by providing some resources on quality reporting. Just moving on to the next slide to kind of give an update of where we are. So Tammy and her team at Texas A&M Rural and Community Health Institute recently just sent you some data. We're hoping to get some additional data next week, hopefully. Fingers are crossed. And I know Tammy just sent out some of the patient safety, the inpatient and outpatient data. There was an issue with the Q4 2020 data that has been corrected and sent out to you. So hopefully you received that email from Tammy. And we're hoping to get some additional data next week. And as soon as we get that, we will send that out to all the critical access hospitals here in the state. But here's kind of a timeline of when we will be expecting some of the newly released data. And so thank you for submitting your data and continuing to report for the MBQuip. And during today's webinar, if you have any questions, feel free to type them in the chat or unmute yourself. And I'll turn it over to Tammy, who's going to give us an update on the MBQuip portal and Emergency Department Transfer Communication Database. Take it away, Tammy.
Thank you, Robert. And Sheila, you can go ahead and go to the next slide. What we've done is we have looked at the MBQuip portal that was designed for y'all, not last year, but the year before in January. Based on your needs as far as having a one-stop shop to house your resources as well as data repositories. So what we do each year, we did this last year and we did it this year again at the end of the fiscal period, which ended August 31st. We look at usage for the portal and for the EDTC database. So I'm going to go over some of this with you. Some of it is not surprising and some of it is encouraging from the use that you guys are using this, and so it helps us know what you're doing with these two, with the portal and the database, and hopefully using it more than not using it by going to some of the other repositories that you have to go to other sites. So this is just a picture of it. On the left side is the portal, no password needed for that. The portal, all you have to do is click on it and it takes you straight into the portal. On the right side is the MBQuip database where you log in. You have a password for that. And the database is where you enter all of your emergency department transfer communication measures, EDCC. And we send you the reminders that these are due on the 15th of the following month of each quarter. So that's where you log that in. The portal is where you can go to QNet and go log in your or submit your CMS and MDQIP measures that are significant, that cross over between CMS and QNet. That's mostly your inpatient and outpatient. And then your NHSN access, where you can go and submit your antibiotic stewardship and your annual survey, as well as your influenza, and then of course you have your HCAHQI for the QNet. So what we're going to do is we're going to look at some of the graphs and comparisons to show you what you guys are doing at your facility, as far as this starts off with the MDQIP portal. And so I'm going to go over some of that data. Next slide. This is what the portal looks like for those of you. I think probably I was looking at the names of everybody that's on here, and it looks like most of you probably have access to this, but this is what you would see, the home page when you go into the portal. And again, all you do is click on the icon and it takes you to this page. You have your QNet, your QualityNet, data repository, your NHSN, and your MDQIP database for EDCC. And as we have said many times before, through these webinars and through emails, each area shows what measures are submitted into that data repository so that you have that in front of you. It also has the deadlines and a little bit of information about it. It also gives you, when you click through the portal on the headers at the top, it does give you the measures, the current measures, a calendar for when they're due. It also gives you resources as far as what you should be using for MDQIP, like the monthly, MDQIP monthly. It automatically updates before I even send you all that email saying that it's available to you. So October is there. A lot of good information that comes to us from Lakita that's in that MDQIP monthly. So it's really good information to you, especially for new users. You also have user deadlines. For example, when these webinars are completed, they're posted to the portal so that you can go through the webinar again in case you forgot something. They're recorded. Sheila records these for you all. And then also other types of recordings and tutorials are available. And then if we're advertising any upcoming webinar, anything that you would want to take advantage of through MDQIP, you usually see that across the header that's always evolving, and then there's always a registration link. So I hope that you take advantage of it and use it as much as possible. And that's a good segue into the next slide. We're going to talk about some of the use. Okay, so what this is showing you now, again, this is the fiscal period for the State Office of Rural Health to do their end of year report, and we finished it at the end of a fiscal period. So this, we didn't have some of these, we don't have all of August, or, and some not even any of the August. So we got the most current data that we have. So this is showing users. As you can see from the pie chart, 86%, right at 86%, are new visitors to the portal. And returning visitors are about 14%. Now, we would like that returning visitor to get up there. We like that we have a lot of new visitors, but we really want the returning visitors to those numbers to get up. And it shows you how many users, 809 users, new users, 780. It shows you how many sessions. So when you go into the portal, every time you touch that portal, that's a session. The number of sessions per user. So you can see we're averaging right about 2 sessions per user. Page views, every time you scroll through that portal and look at a new page, it's showing you that over this past year that there was 3,413 page reviews and pages per session. So when there was a session, when somebody went in and had 2 sessions, but each session had an average of a little over 2 pages per session. The duration and the bounce rate. Now that bounce rate I don't like because we try to keep that down. And to me, that because it's not a password where you have to use a password to get into the portal, I would say it's more maybe if your passwords weren't working. We shouldn't have that high of a bounce rate, so we're checking into that with our IT department to see why that number is so high. Next slide. So this slide shows you users by time of day. So this is interesting to me. For the portal, it's going to be pretty consistent between the portal and the EDTC database. You're going to see a little more use of the EDTC database because you're submitting data. But most of the time that you're using the portal is between 8 o'clock and lunchtime. And then, of course, around 1 o'clock to 4. And it looks like most days that you're using the portal is Wednesday through Saturday. That's what those blue colors show you. So the highest use would probably be more midweek towards the end of the week. And this does make sense by the work that you guys do. Next slide. This is a comparison from year to year. So we had a comparison from from 2019 through 2020, or I'm sorry, yeah, 2019 through 2020, and then 2020 through 2021, which is our last fiscal period. Green means that you're gone up, and of course, red means it's gone down. So when you look at that, users percentage-wise have gone up. I think somebody's saying the audio is a little bit garbled. Are y'all having trouble hearing me?
Yes.
You are having trouble?
Yes.
Hey, Robert, that's your fault.
I jinxed you. Yeah, it is a little garbled.
I usually call in on my phone for these webinars, and so this morning's webinar that we had, I asked about the video, the audio. I guess I did okay. Sometimes my speaker on my laptop's not that great, and so I will do my best to finish this up because I would hate to. Yeah, I'm almost there. I would hate to disturb the webinar. Can y'all hear me at all?
We can hear you, Tammy. It's just a little garbled.
Okay, well, I'm going to finish up, and going forward, then I'll make sure I use my telephone when we have these webinars like I did before. So anyhow, on this particular slide, this is showing you in green the positive number. So it looks like from year to year, we had an increase in our users. We had an increase in our new users. We had an increase in our sessions, and we had an increase in the number of sessions per user. We had a decrease in page views and pages per session and average session duration. And actually, it shows we have a decrease in the bounce rate. So the bounce rate was high last year too. So again, we are checking into that bounce rate, and I'll get back with you on that. This did not give us all the way through the end of August, and we did it more mid-August. So some of those numbers probably are skewed a little bit because we would have had a little bit more data. Next slide. And so quickly, this is going to be on the usage of the EDTC database, and we're going to look at the same graphs, but you guys are using this to enter all of your EDTC data. So the next slide, please. This is what the database looks like when you go into it. We've just done some updates to the database, and so that's why you see a purple ribbon up there. This is where you're entering your EDTC data every month, up to 45 records a quarter. And then we extract this data from the database and submit it to Robert at the state level to submit it on to the federal level. Next slide. Again, this one's looking at users for EDTC. We see the numbers are a little higher. Our numbers, returning visitors are higher for the EDTC database, again, because you guys are submitting it. And new users, we have a good percentage of new users because you guys have added on at your facilities some new staff to submit your EDTC measures because you've contacted me and I've set them up in the database where they set up their new password. So this gives you some numbers. It's up and down throughout the months, but that's basically because of when you submit the measure. Some of you do it at the end of submission time, and some of you do it throughout the months before the quarter ends. Next slide. And page views is the same. This shows you the number of times that you guys go into the database. There's not as many page views of the database as the portal. And as you can see down there where it says average session duration, much higher. You're in there about 14 minutes because you're entering data. So we expect that average session duration to be higher like that. And then the bounce rate for the EDTC database is significantly lower than the portal at 29%. And again, I thought it would be just the opposite because of passwords. Next slide. This is your time of day, and you can see there's the blocks are pretty solid in the times that I talked to you about the portal. It's pretty filled out with that medium blue to dark blue, so it looks like you guys are doing this mostly at the end of your work week. You're submitting your EDTC measures into the database, and again, between 8 and noon and around 1 to 4 o'clock, with the heaviest being around Thursday, going into Friday, maybe part of Wednesday, so mostly mid to late week. Next slide. And this shows from year to year, the past 2 years. The number of sessions per user is green at 20.39%. Page session and average session duration was up, the percentage was up a little bit. We expect that some of those other percentages are down because people are used to now using the EDTC database. So when you go in there and you've used it before, you're not counted. You know, as a new user, you're counted as a user that goes back. I've asked our IT department how this works when you have significant entries maybe during the day, and they're checking on this because we think it only counts you as one. So once you enter a password that day, if you go back into it that day, it won't count you as a second time. So if you're in and out of the database on a particular day, we believe you're only counted as one. And again, we don't have August, in the end of August data on this one. Next slide. So here's your influenza data. We have some work to do on your, next slide, on your influenza data. You submit this into NHSN. I know some of you have difficulty with this data repository and working with this data. I had a couple calls yesterday with a couple of users that also told me, 2 different users, that they're submitting data for other measures like CAHQI and CLABSI. And the reports I just sent out to y'all last week for Q1 of 2021, some of you had NAs. Now, we don't submit that data as a state. That's not an NBQIP measure that we're working on. Those are additional measures. But you see on your reports that some hospitals are still submitting that data because those are also measures that they look at through infection control and core measures. If you, for some reason, and I don't know, Sheila probably will speak to this, but if for some reason your data is not showing up and you know you are submitting it, whether you use a vendor or you're doing it yourself, I would reach out to them to see why your data is not being pulled. We don't pull that data. That data is pulled at a national level and then analyzed and then put into those reports sent back to you all. So I don't know why your data wouldn't be showing up if you're submitting to NHSN, but I've heard that several times. For the influenza data, we have, again, some work to do as a state. We have, of our hospitals that we have in Texas, 88 critical access hospitals, 26% reported on the flu season this past flu season, with a Q1 2021 showing the update. This is, of course, seasonal, so from September to March is when you're actually doing this type of measure work. And then at a national level, they're at 53%, so 53% of the hospitals are submitting. For our overall rate, we are at 87% as a state compared to 92% at the national level. And then our 90th percentile, those of you that are doing an excellent job, the 90th percentile is 97% for the state and 99% for the state. So this last flu season, I'm sure we know there wasn't as many flus. However, we still have to immunize our healthcare personnel. So we'll see how we compare to this next period for the next flu season. That's all I have. I'm going to turn it back over to Sheila, and then I'll talk a little bit more when we get to the antibiotic stewardship program on some data that we've added to the site. Sheila?
And Sheila, sorry, real quick before we move on to Sheila, there were a couple of questions just to address, and if anybody has any questions, feel free to type them in the chat. But Tammy, just to help explain, so whenever you go to the website, the NBQIP website, portal website, and the link I posted in the chat box, to click on there, there is no login required for that landing page. The only place for that website a login is required is to submit your emergency department transfer communication, your EDTC. So to submit your EDTC data will require a login at that point. but to get to the MBQuit portal website, there is no login required. And I don't know if you wanted to add anything else to that, Tammy.
Correct. And so you can go to it two different ways. You can either go to the CAHQI website, and that's when you saw that screenshot with them side by side, or you can go specifically to just the MBQuit portal. If you get into it a lot, it'll show up. All you have to do is type into Google MBQuit, and it's going to pull that up right away, portal and the database. But if you go to the CAHQI website down and then scroll down to the login on the homepage, it'll bring it up side by side. We wanted to make sure that people had access to the portal from all over your hospital and that many people could access the portal. So we felt like we should password protect that because we're not putting in any data. It's more of a resource page and you're going to it just to access the other repositories. So it's just a one-stop shop for all of your needs and all of your resources. So that's why we didn't password protect that. But yes, on the EDTC database, when you have a new user, you contact me and we set you up the database and you get automated and then set up your user.
Thanks, Tammy. So if anybody needs help getting access into the EDTC, just send us an email and we'll work with Tammy to get you your login for the EDTC part so you can submit your EDTC data. And I think that was it. But if you have any other questions, feel free to type them in and then we'll turn it over to Sheila.
Thank you, Robert and Tammy. So we wanted to talk about our influenza measure just a little bit so we can remind, just as a refresher of what our best practice is and what they're looking at with regard to this measure itself. So this right here, the HCP used to be your OP27. So if you've been involved in quality at your hospital long enough with the MBQuit program, then you knew it as OP27, but they changed it to HCP when they dropped the measure for the patient side. So we no longer track that one with MBQuit. Not that you don't need to pay attention to that one, but everybody was doing such a good job asking their patients about influenza status as far as vaccination. So they no longer kept that one as a priority and they dropped it and just used the HCP. So this does measure the percentage of the healthcare professionals, the people who work inside your facility that have that influenza vaccination. Ideally, yes, we want to see a high number. We want everybody to be getting their influenza vaccination if they are able to do so. And then this is, of course, reported through NHSN. So that right there lists the three categories of the HCP, beginning with October 1st and then ending in March 31st, which is our typical flu season. So any employee that you have on the payroll, your licensed practitioners, whether they're employed by your facility or not, so even if they're independent practitioners and they have privileges in your hospital, you should also be taking note of their influenza status, and then of course students, trainees, or any volunteers. It's optional as far as tracking for any contract personnel. And then the things that you want to be taking note of are anyone who received a vaccination at your facility, outside of your facility. If they did not receive that vaccination because they had some sort of contraindication to the vaccination, or whether they just simply declined. And so those are the data elements that go along with HCP. So here's some information just as far as reporting with COVID, because COVID kind of changed a whole lot of things for us. So we started not only looking at reporting influenza, but also reporting COVID. And you can expect that at some point in time, especially with mandates that are coming down, we know that the CMS mandate coming down as far as all healthcare providers in facilities that take any kind of Medicaid or Medicare funds are to be vaccinated. So they will be asking for information and tracking that information as well. So you just need to make sure that you are prepared to do so. Now, some of our best practices, everyone should have a policy in place regarding influenza vaccination. And then of course, those policies would be updated to reflect anything that's added related to COVID as far as mandatory vaccinations or what that's going to look like, and what your policy is related to that. And so everybody should have something like that in place. Part of that policy and the best practice is that you require the vaccination if they opt out of the vaccination or decline with regard to influenza, that you have something in place that there would be mask use within your facility for those that are not vaccinated. Mask use would not be necessarily limited. A lot of people, I think, take that in terms of being limited to inpatient rooms, but the best practice is that it's in the patient care areas. And if your patients are able to get up and walk around your facility and everything else, then mask use would certainly be indicated throughout your facility for those that opt out of vaccination. It does include a portion for best practice that you would be obtaining an actual proof of vaccination if someone reported to you that they had it done elsewhere. So this may be if you have someone who maybe works at your hospital and then maybe they pull some part-time shifts at another hospital in the city or something like that. If they come to you and report that their vaccination was obtained at the other facility, then you would want to ask for proof of that vaccination and not simply just that they told you they got it elsewhere. And that way you keep documentation and everything else. And this, of course, would be reported in your numbers in NHSN. So Robert and I had a conversation, and I wanted to keep some antibiotic stewardship information in here simply because we're talking about influenza and NHSN. And I know there are a lot of people in our facilities, our critical access hospitals, especially new people to quality and things like that, that maybe have not gone through that process to get your access to NHSN. And the influenza measure being one of those that, and like all of these measures with InVQIP, of course, there's a voluntary component to participation and reporting, but antibiotic stewardship is one of those conditions of participation with CMS, just like their new rule states for COVID vaccination will be a condition of participation. And you report that through NHSN. So it really, really is important that everybody gain access to NHSN so that you can be able to report on these measures. And I will go over, I'll show you the links and how you go through that process here in just a bit. But for antibiotic stewardship, this rule went into effect. The effective date of the final rule was November 29th in 2019, and they had a couple of deadlines set, one of them being the end of March 2020, and then the second being March of 2021, when everything had to be fully implemented in all facilities to include our critical access hospitals. So to be in compliance with the condition of participation, then you need to be reporting on those 7 core elements of antibiotic stewardship. And then you also need to be tracking data associated with antibiotic use in your facility to support that you actually are doing your due diligence when it comes to antibiotic stewardship. This is the actual rule itself. And I mean, it's pretty self-explanatory, but it does state, if you look down there towards the bottom, that part of this includes not only your antibiotic stewardship as far as the appropriate use of your antibiotics and having your infection prevention program through all of your departments, but that also you are showing that you're collecting data, that you're actually monitoring that, and that you're actually doing something with the data to show that you're using them appropriately, that you're having reductions in your misuse of antibiotics and things like that. So all of that is very, very important. These are the 7 core elements that you would answer that survey within NHSN. These are the 7 core elements that are included in that. Your leadership commitment being that your hospital leadership, your board at the board level, this is something that should be documented and in writing. That they are committed to your antibiotic stewardship program. You have an accountability piece and drug expertise. Typically, your pharmacist would be someone who would be your drug expert. It may not be. Maybe you have a physician champion who's had additional training in antibiotic stewardship and things like that, and they can certainly be that champion person for you. There's action, you're tracking and reporting. That is where you have to be collecting data. You have to be monitoring your physicians for appropriate use, etc. And then, of course, education. Education, you just simply cannot implement a new program if you're not providing education to everyone and letting them know what's expected of them, what their role is. So in terms of nursing staff, your nursing staff need education to know things that they can look for in a patient record to maybe flag or notify a physician on. Your physicians need to have education and understanding of what your antibiotic protocols and your procedure is inside your facility. Pharmacy staff need to understand what their role is. So basically everyone needs some education in antibiotic stewardship. This also applies to patients and families, because if we're not educating them properly, then it's not very helpful and we're not going to get really good at compliance. And we certainly know that one of the reasons we have issue with antibiotics is that for many years, when people go to the doctor, they're sick, they want something in return because it makes them feel better. So we write a bunch of prescriptions for antibiotics, even if they're not necessary. So we have to start re-educating our patients and their families as well when they're not going home on antibiotics, so they understand why and everything else. And I know Tammy's got some of our information. She just got our most latest data with regard to antibiotic stewardship. So I'm going to let her give that data to you so you can see where we're at as far as our hospitals and being in compliance.
Thanks, Sheila. So again, this was just sent out last week, the first quarter of 2021. I'm so glad that Sheila mentioned physician participation, which is a requirement now to have this at your critical access hospital, not just your CPS hospital. So one of the things that we have to build up and work on is we have 44 critical access hospitals reporting on the antibiotics program, the stewardship program that they have run. So if you're a hospital, or a CPS hospital, so that's only 50%. If you are a hospital that receives a report and you don't see data for antibiotic stewardship, again, this is another set of measures that's submitted through NHSN. So if you're still having trouble with your data being reported, you need to be I see that they're having trouble hearing again, but you need to be very careful to not do this and not get credit for it. So I'm going to go through real quickly. 44 hospitals are reporting, and for the different elements, leadership. So again, people haven't. Can you all understand what I'm saying? I can come back to this and call back in.
I think Tammy, because we discussed the data before Tammy got on the call. So basically, out of 88 hospitals, we're at 50% of hospitals, of our critical access hospitals, have actually met these 7 core elements and reported on it. Oddly enough, our lowest compliance is related to that education. And so that's why I stress the education piece, because that is so incredibly important. And I think that we're in the 80-something% there, if I remember correctly, from what we discussed as we were waiting to begin this call. I think Tammy's working on calling back in.
Muting. I'm gonna type into everybody the percentage.
There you go. Perfect. But we're lagging behind a bit as far as compliance, and everybody should have something like this implemented. And since it is reported in NHSN, it is just absolutely critical that someone from your facility have access to that and be reporting the measure. If you have someone in infection prevention that does a lot of your reporting through NHSN for you, then like if they're reporting your CAHQIs and CLABSIs and things like that, then this is certainly something that you want to discuss with them so that they can report. It's always my recommendation that more than like at least you have at least 2 people with access to be able to report data, because if you leave that up to one person and something happens, then your data is not going to get reported and nobody has access, and you should not be utilizing each other's logins just for security purposes and everything else. So really important that we stay on top of that. Now, there was a question as far as in the chat box, who do you monitor for antibiotic stewardship, whether it's ER, OBS, clinic, inpatient, or swing bed? So all of these measures are inpatient measures, but your antibiotic stewardship, you really, really want to include all of those other pieces. So if you have a clinic associated with your facility, then you really want to include someone from the clinic setting in your antibiotic stewardship discussions, because you need them to help reinforce antibiotic stewardship. If you're trying to lock down unnecessary antibiotic use inside the hospital, but your clinic is still giving everybody antibiotic prescriptions, then your patients are going to not be happy when they present to your hospital and they come through your emergency department for something that they're going to get discharged over to go back home, but yet your ER physician is not going to give them a prescription. And so you need to make sure that that message is the same across the board. If you have physicians in town who may not admit, maybe they do not come in and see patients inside your hospital, but you have other practitioners inside your community, have that conversation with them and pull them into your efforts also, because it just, like I said, it's really hard to be successful at antibiotic stewardship unless we're going to change the mindset of the patients and families that we treat as well, because they need to understand why we're not just handing out prescriptions for antibiotics anymore, and when they're not necessary.
And Sheila, can I add to, and maybe you can expand upon this, and I'll ask anybody else too, the quality champions from the critical access hospitals that are on today's webinar, but what specific measures do you collect when it comes to antibiotic stewardship? And I know, Sheila, I've heard you talk about timeout before. Maybe you could speak to that a little bit, but anybody, the critical access hospitals, maybe you could type in the chat box too, some of the measures that you collect internally that are specific to your antibiotic stewardship program.
Yes, so some of those things that you would look at in terms of data, like Robert said, do you have a process in place where you utilize a timeout after a certain period of time to give yourself the opportunity to look back over those culture and sensitivity reports, because they should be back by then, when it did, based on when your facility normally sees those, so that you have that process to take a moment and evaluate whether or not the patient's on the appropriate antibiotic. Maybe it needs to be switched over to something else. Do you switch your patients from IV antibiotics to PO when the patient's able to have that? Or do you leave them on IV antibiotic for their length of stay and then send them home on PO? Things like that. Those are all measures. Your physicians, you should track data based off of your providers to show who is adhering and doing the appropriate prescribing for antibiotics, and maybe who's not paying attention, who's giving the wrong antibiotics on a regular basis, things like that. So Andrea said that they have a 72-hour time, allowing time for cultures. Absolutely. And so that way they have the ability to take a look and make sure that the patient's actually on the right antibiotic and not getting something unnecessary. And that's what they want to see. If someone comes into your facility, that's what they're going to want to see. And I because we only have half of our critical access hospitals that are compliant with this right now, and we're starting a new cycle year, I really need to keep this here, because CMS, I think with COVID, I think CMS is going to start looking at a lot of enforcement as far as making sure that people are compliant. And if there's one, I mean, like they may look for information on COVID vaccinations to make sure that you're compliant with that as a condition of participation. If they see that you're not compliant with one thing, then they can always look for other things that are conditions of participation that you may not be compliant with. And we certainly don't want anyone getting into an issue with CMS or one of these bodies because of some of those things like that. So I think it's just really important to stress the need to be able to log in and put your data into NHSN. If you have any questions, please type them in the chat box, and Tammy put the data in there so you can see where we fall right now with regard to compliance on those issues. Again, I'm not sure how education is low unless there's just not a good process for the education in facilities for them to be able to report to it. But we need to have a good formal process for education and document that it's actually been done. So where should you be right now? Clearly, everyone should be reporting compliance with the 7 core elements of antibiotic stewardship. And that reporting is done through NHSN with the influenza data. And if you don't have that, then you should get started on that. I'm going to stop share for just a second. I'll go back to that, and then I'm going to pull up and show you kind of online what it is that you should be looking for in terms of gaining that access for NHSN.
And while you do that too, Sheila, I was just going to mention through our visits with many of the critical access hospitals here in the state, Sheila, Tammy, and myself, and the regional coordinators, we've noticed that that you're already collecting the data. For example, in influenza, you may have an employee health nurse or a nurse that wears multiple hats, and you're already collecting it internally. And the same for antibiotic stewardship, leadership one. Your leadership hospital board has probably already voted on your antibiotic stewardship. So we just want to make sure you're getting credit for the good work that you're already doing.
So everybody should be able to see my screen now. So if you need to sign up for NHSN, you can simply just Google, like here, sign up for NHSN, and it's going to pull this up, and then you can click on this one right here, and it'll pull up a page that looks just like this. Now, once you are here, you're going to have to read through all this introduction and everything because you need to agree to all of their terms. But once you hit agree, it's going to open up this screen, and then you need to fill out some basic information. Okay. Now, when you're filling out all of this information, at the very bottom of this, it talks about NHSN training date, because you are supposed to go watch their training videos and things like that and have completed some of that training when you go through NHSN. So it's going to ask you for that. And that's just, telling you how to get in there, how to look at the data and everything like that. And I'm gonna see if I got to get this little window to go away up here at the top so I can see the rest of my tabs. And it's not going away. So one thing that's really, really important. So then once you fill out all of that other information and you submit it, if you do not put anything in there that you completed the training, it's going to send you an email. And I want to show you what it will look like, because it's really important that you pay attention to that email when it comes in. Sorry, I have to quit sharing so that I can get to all of it, and then it'll show you on the screen. I'll show you exactly what this email is going to look like. It's important that you watch for that email and that you actually finish the steps. So once you have filled out that basic information, I saved my email back when we were doing the HIN project and everything, because I'm really notorious for not deleting a whole bunch of emails. But they're going to send you an email like this: welcome to NHSN. And it's going to tell you your facility or group name, and then it's going to tell you your user type. We are other because we're a hospital association, but you should have a hospital type and everything else. And then it's going to tell you that you have to agree to their rules and everything else. Click on the box and you can move forward. But you've got to remember to check for that email, because if you don't, all of that's going to expire, and then you'll have to start the process all over again. And it is a lengthy process. Let's see if I will. Now, do y'all see the web page since I changed it, or do I need to stop share and go back to the web page?
Stop sharing, go back. We see the email
Okay.
still.
Okay. Sorry about that. This is the one thing I hate about sharing the screen. It makes you go back and forth. So let's go back to the web page. Okay. So if you click on that email, in that email link, it's going to take you to this question where you're going to click on the date and submit it to show that you did that training and everything else. Now, let's see if I can get to the right link if I don't click on that. And then, okay, now do you guys see this page that says NHSN educational roadmaps?
Yes, ma'am.
Okay, so right here on their webpage, they have a lot of educational things for you to do in order to learn how to put the data into NHSN and everything else. So it's really difficult to call them up on the phone. They're no different than anybody else. Most of the time, they're going to direct you to their technical assistant, and you're going to call and you're going to try to get somebody on the phone, and it's really difficult. I can tell you from personal experience. Once you get someone on the phone, then it's even more difficult to ask them a question and get them to actually answer the question you asked them without giving you a bunch of other information. So it's very confusing. They will always ask you if you have been to their website and checked out their training before they start giving you a lot of information. So please familiarize yourself with the things that they have on here for you so that you can take a look at those. There is an e-learning option here. And when you go to the e-learning option, it opens up all these components down here for users of NHSN. Okay, so here's resources for those that are new to NHSN. This is all stuff that you don't have to pay for or anything else. It's just things that you can log in and that you can view that will help teach you how to put data in and everything else. There is also a presentation. I'm going to send this one. They actually sent to me. They sent me the link for this one, and I'm going to share that one with Robert. But this basic, so that we can, and Tammy, so we can put it on the webpage and everything else for all of you. But basically, this talks. I mean, it walks you through step by step. So it has a lot of screenshots on here and things like that. I'll scroll down through it. I won't go through the entire thing for time purposes, but it literally takes you through the logging in process. It shows you what the landing page is going to look like, takes you to the home page, gives you an overview on everything, but then it literally includes screenshots to show you where things go, which I think is probably the biggest question that we get is exactly where do you go when you get in there to put data in? I know that if you already have access to NHSN and your data is not coming up, there are certain permissions and things that you have to go in and do on a recurring basis. So annually or whatever schedule that they have set up. And if you're not checking those boxes in there as scheduled as you're supposed to, then your data will not show up. We had the same problem when we tried to pull data during the HIN project through NHSN. If you're not going in and doing those permissions and everything else as you're supposed to, there's just certain things that you have to check routinely, then they're not going to be able to pull your data to show that you actually reported it. So just make sure that whenever you get a notification or something's in that box that says this is a reminder, you need to go in and check these things, or whatever the case may be, that you're actually doing that, because otherwise your data is not going to be there. This is a really lengthy process to actually gain access. I discussed with Robert this morning, we've got an epidemiologist that has agreed to come on. I cannot get someone from NHSN to do a live training. They simply will not do that. But I do have someone who has agreed to do a training because they're very familiar with the NHSN. But what we want to do is give you time to start that access process. So if you do not have access to NHSN, please go to the link and fill out the information and start the process so that you can get your card and log in, and then it may make more sense to you once we do some training, because otherwise I think you'll all still have a whole lot of questions and everything after the fact. So I think that would make more sense. Anybody have other questions? And then I'm going to go back to our presentation.
While you're doing that, Sheila, I just wanted to add, can you all hear me now? I switched over to phone.
Yes, ma'am.
Yes, much better.
Okay, good. I just wanted to add on the access, I saw a question on getting the recording. The MBQuip portal, the MBQuip portal, all the recordings are on that, and when you go to the resource page, there's going to be a drop down on the left side and it'll show you the recording. So Sheila will supply that to us, and then we'll get it, we usually get it posted within the day that Sheila sends it to us. So you will have the recording of this webinar and the previous webinars. And then I just want to add one last thing before I forget. For the EDTC database, when Sheila was talking about if you don't do everything that you're supposed to on this end, your data won't be included. For the EDTC database, several of you have added people at your facility that want access to submit EDTC measures. When we add you to the database, you get an automated, generated email that whoever's being added. Once I add them, that email is generated from the database. That email has a link. When you click on that link, you set up your password. However, I know everybody's so busy in the hospitals, if you don't access that link within 1 hour, it doesn't work anymore. So when you're going to get set up, I try to send an email and say, stay right there by your computer or your inbox, because the link is only good for an hour. So I just want to remind everybody that when they're adding people to submit data for EDTC, that they stay by their computer once we get them on. Thanks.
And thanks, Sheila. Now looking at the additional resources, and in the comment, I also just wanted to thank Kimberly real quick. They track all the antibiotics used inpatient, and if a culture is ordered, they make sure the appropriate antibiotic is being used. If not, they change it. These are given to a physician who is also a pharmacist to review for appropriateness. Thanks for putting that in there. And if y'all have any other measures, I know we're wrapping up on time, feel free to add those in there, because I know it's extremely helpful for other critical access hospitals to hear what some of the measures the other critical access hospitals are collecting whenever it comes to antibiotic stewardship. So thanks for sharing that, and please keep them coming. So as a resources for some upcoming webinars, we emailed this out, and Tammy also posted this on the MBQuip portal website, but there's an upcoming webinar on November the 17th, a little over a week from now, on enhancing antibiotic stewardship programs in critical access hospitals. This is specific to critical access hospitals. It's on Wednesday, November the 17th. If you haven't registered yet, go ahead and register. And if something comes up and if you're unable to attend, they usually record it. So if you're registered, you'll at least get the recording that you can watch at a later time. And this will be put on by our friends at the Federal Office of Rural Health Policy with the CDC. And this is a nationwide webinar to work with critical access hospitals around antibiotic stewardship. So we highly encourage you to attend if this works with your schedule. Also, save the date for our next quarterly quality improvement webinar. That will be on February the 22nd. If you have any suggestions for topics or ideas, let us know, and we'll be sure to include those in this quality improvement webinar or at a future one. And also, you may have heard both Tammy and Sheila kind of talked about some issues with submitting the healthcare provider data, influenza data. So if you look also on the MBQuip portal website, there's a resource section, and on there it has monthly MBQuip reports that are put on there, and I always look at them to see what some of the tips are when it comes to reporting. And on there it talks about if your healthcare provider influenza data is showing. And just to keep in mind that this data is a seasonal data measure that's submitted. And this year it's due May 16th, 2022. So we have some time to get you set up with your SAMS card and to get you into NHSN Tennyson. But it's normally due on May 15th, but because that's a weekend, it's been extended. And NHSN will let you enter it at any time. But since the data is provided to us once you get it submitted, it's important that we follow the deadline of May 16th. So sometimes if you submit it after May 16th, that may be why we don't see it in the report. So it's important that we do it before that May 16th deadline so you get credit for it and we can see it in there. And then also, one of the things Sheila had mentioned, and there's a link on here you could check. But for the notice of participation, so the NOP, if you have submitted the data by May, but it still shows no data, we would need to check to see if you had submitted an inpatient notice of participation. And there's a video on there, a CMS tutorial on how to confirm whether or not you've completed the inpatient notice of participation. So that could be another reason why we may not be seeing your influenza vaccination data, is because you may have not submitted the notice of participation. And there's a YouTube link on there, and I'll also post it in the chat, that you can look at to make sure that you've done that. And there's also another really cool tool, and Sheila went over some of this too, but this is the website for instructions on how to collect and submit the healthcare provider data. So that's a good website that has information on some resources, and I'll post that in there too, so you get access to that. And then moving on to the next slide, just a reminder for some of our MBQuip submission reminders. Thank you for submitting your data and all the hard work you do. This is a link to the MBQuip portal website, where it provides tools and resources on the measures. And in January, the Emergency Department Transfer Communication Q4 data will be due on the 15th, as well as the HCAHPS data will be due the following month in February. So those are two of our upcoming deadlines whenever it comes to MBQuip reporting. And on the next slide, happy National Rural Health Day. I'm sure many of you have plans at your facility, and what a year it's been with COVID and everything going on with that. But I just we all want to wish you, our friends at Texas A&M Rural Community Health Institute, Texas Hospital Association, and us here at the State Office of Rural Health would like to wish you and everyone at your facility a happy National Rural Health Day. It's November the 18th this year, the third Thursday of the month. Thank you for all that you do. We know it's been what a year and a half, or over a year it's been. So thank you for everything that you do, and happy National Rural Health Day. And feel free to send us some pictures. We always like to see what the critical access hospitals and the rural hospitals are doing to celebrate National Rural Health Day. So thanks for all that you do, and happy National Rural Health Day. And then on the last slide is if you have any questions, and thank you for spending an hour of your afternoon with us. We hope to continue to provide these on a quarterly basis with some resources and tools to help you out whenever it comes to submitting data for Medicare beneficiary quality improvement, as well as doing quality improvement at your facility. We have a couple of minutes if anybody has any questions, or if there's anything that Tammy or Sheila would like to add as well.
Happy Thanksgiving. I hope everybody has a good holiday. Go have a really good meal with your family, and eat too much and watch football.
And stay well.
Yes.
Stay well.
Yes, and happy National Rural Health Day, and thank you all for attending this webinar, and we look forward to hearing from you soon. And if you need anything from us, yes, dressing. Yeah. Please don't hesitate to reach out to us, send us an email, give us a call. We'll be more than happy to help you out. But thanks for all that you do, and happy National Rural Health Day.
Yeah, and email us your favorite recipes. I'm always looking for new stuff to cook. So if you have a favorite recipe, email it, share it.
Thank you, everybody.
Bye, y'all.
Bye. Thanks.